So we have Joe Wolk joining us, CFO of Johnson & Johnson. He's a lifer, as they say. You've been there a long time, right?
Long time.
Okay. In probably each and every finance function that you can imagine, from running a division to investor relations to everything else. We are super excited to have Joe and Johnson & Johnson here, one of the most admired medical tech and healthcare companies, pharmaceutical companies in the world. Truly has changed, if you think over the last 4 or 5 years, totally changed our lives with the pandemic and coming out of that and steamrolling through that and trying to really deal with that tremendous growth. And then this past year, as hopefully all of you know, is Joe helped spin out a small $40 billion business called Kenvue. That's the Band-Aids and the Listerine and the Benadryl and Tylenol, all the things that we use day in, day out, and he sits on the board there. So the list goes on and on. I'm super excited for today's discussion and dig a little bit further. So go ahead, Simon.
Okay, thank you very much, Jeremy. So Joe, we talked a little bit, and I know, but I'd like you to share with the audience that you have a very deep family background in not just J&J, but also in northern New Jersey, in Edison, New Jersey. So if you want to just introduce yourself and tell us a little bit about your perspective on how the world around you has changed for you and your family as a result of the kind of technology developments that we've been discussing.
Yeah, sure, Simon. And it's just a pleasure to be here with everyone. I think it's just outstanding that we have 400 plus CFOs in a community getting together. I applaud you for taking the time to network and learn a little bit more about our specific roles, which are certainly dynamic and ever-changing. Yeah, my history with Johnson & Johnson goes back much further than the 25 years that are on my resume. My dad actually worked on the factory floors as I was growing up as a kid. And in Central Jersey, Johnson & Johnson was one of those employers where if you threw a stone, you were going to hit a Johnson & Johnson location. My parents would go to my Little League games, my basketball games. They'd run into people they work with. Actually, one of my most prolific moments is when I first got this role. We had a shareholders meeting, which back in that day was still an event, right? Today, they're mostly virtual. That was facilitated by COVID, and that's a good thing. But they had like red velvet ropes, and I was being announced as the new CFO. And at the end of that meeting, there was a little old lady who stood behind that velvet rope, and it was a colleague of my dad's who just wanted to say how proud she was that I had made it to that point. Now that was prolific for me because if you know anything about Johnson & Johnson, what I hope you know is about our credo. And our credo was penned by Robert Wood Johnson, the grandfather of one of the founders, the grandson of one of the founders, right before we went public. And he very simply, in 4 paragraphs, talked about the responsibilities of being a publicly traded company. Let's serve our patients, let's serve our employees, let's serve the communities we live in, and let's serve our shareholders. And in that document, the word must appears 21 times. So very unequivocal. It wasn't like you can say, well, this one is going to be at the expense of this one. You had to make a decision. And today it serves as a guiding document, even though it's celebrating its 80th birthday. I looked at that older woman, that colleague of my dad's, and thought, boy, that's the credo living in action. So it was really inspirational for me to kind of get this role, certainly humbled by it. But if you can't jump out of bed and kind of charge each day with a special energy, when you see somebody like that, it's then something was wrong with me.
So if we connect that to the finance function, obviously the focus of today and everybody here, how have these changes that you've seen and from your dad's generation, your generation, all the things that you've seen during this career at JJ, how would you characterize both how the finance function has changed, how it supports the business, but also what you think is coming next? What path do you feel that we're on?
Yeah, it's funny because I thought about this question thinking that when we're talking about the evolution of the CFO, the more the things change, the more they stay the same. You think about your book, and you talk about progress at very critical moments in time, and we still have the same struggle each time there's significant advancement, right? How do we democratize it or keep it in the power of a precious few to optimize that advancement? The role of CFO is kind of very steady, right? We have to have integrity around our financial statements. We've got to be stewards of compliance. We have to bring objectivity to the discussion around investment. right? We want our research and development people to think they can invent anything in the world. We want our commercial people to believe they can sell anything in the world. But then we also need to bring it back with, I think, good financial discussion and, well-grounded assumptions. How you go about, I think, doing those things more proactively going forward has changed, right? So when you think about how do you recruit for your accounting teams, they have to be bilingual now. It's not just knowing debits and credits. You need them to know that. And that's actually one of my fears, I think, going forward is if people are just getting reports out that we know to be accurate, are they going to understand and do the, as I look at in the audience, I think there's some people my age, where you sit down and you do the T accounts to understand, well, what's really going on here, right? I do think technology is great in that it will enable better compliance. It should make much more efficient the process of collecting our results. It should enable us, I know there's a panel today on cash is king. It should enable us to be better at working capital, right? We should know when, at least in Johnson & Johnson's business, a medical device leaves the supply room from a hospital or a drug or a biologic leaves the pharmacy, that needs to be replaced, right? We should know that real time, and those are some of the great, great benefits. If you think about what AI is doing now, most people probably don't think Johnson & Johnson's a tech company. We employ about 3,000 data scientists. We've got 1,000 different people writing code for new medical devices that will either help with robotic-assisted surgery or monitor knee replacement systems and how they're doing 5 years after the fact, after they've been installed. There's a lot going on. It provides for diagnosis, right? You can take an electrocardiogram, put in the profile of the patient, and maybe uncover things that were beyond what the electrocardiogram was designed to do. With discovery, we're now able to run simulations, millions of simulations within about a 6-week time frame. Just 3 years ago, those 6 weeks took about a year and a half, right? So that leads to better advancement. And then personalized medicine too. You have genetic codes, and Dr. Bill Hite, who's one of our top research folks at Johnson & Johnson, said to me about 10 years ago, you give me a zip code and a genetic code, I'll be able to tell you 95% accuracy what type of ailment that person may come down with, right? That's the way we can kind of use AI. But I was so heartened to hear you say it doesn't replace humans, right? You can diagnose things, but unless you have somebody looking over that chart, that medical chart, something could get missed. There could be a wrong diagnosis. So I think we're always going to have to balance that. There's a lot of progress that can be made, but it provides more opportunity than I think downside.
So perhaps we would say a few things about Kenvue and the split off, in particular the role of the finance function in that, and you, without getting too much into the weeds, what kind of lessons or perspective would you like to share with this audience on that experience?
Yeah, so I don't know if Paul Rue, who's the CFO of Kenvue, I know he was on the list to make it. I don't know if he made it. He did a tremendous job. I would be remiss if I didn't call him out. But it was really somewhat of a fun project. We actually started looking at this about 6 months after I started this role. So that was about 2018. COVID hit, so that slowed things down. But a couple of things that I think that were important. We didn't start with a financial justification. We started with strategically, is this the right thing to do? And if you think about med tech and pharmaceuticals, it has become a very different business than even science-based consumer products. Consumer products are now very much influenced by a celebrity endorser, right? So Kim Kardashian says, hey, this face cream worked for me, or Jennifer Aniston. People like Jennifer Aniston, they like Kim Kardashian, they're gonna go and buy that. It's very, very different and much more data-oriented with a med tech solution or a pharmaceutical solution where you need to prove to the healthcare providers that these actually make a difference, right? So very different there. You need a different level of agility. So from a strategic point of view, it just made tremendous sense. And then we looked at the financials. And I think when you think about capital deployment, as a CFO, I was faced with potentially returns of mid-teens on a pharmaceutical product that maybe had a lot of risk because it was only through phase 2, or an 8% return on capital for a consumer product that was already marketed and was a matter of just commercial execution. That's a tough place for a consumer leadership team to win, right? So I think we did them a service by letting them kind of go their own path. What I will say is we were very militant about ensuring folks would not get project fatigue. And by that I meant we did a separation of a $40 billion market cap company, $15 billion in revenue, about $3 billion in free cash flow. We did that in about 17 months. That was pretty fast. If you talk to JP Morgan, Goldman Sachs, EY, people who do this regularly, the reason we did it that quickly doesn't mean we had a playbook ready to go. We never planned to do this, and we don't plan to do it again. But you make quick decisions. You get the responsible people in the room. I think we learned some of that during the pandemic. I was telling you earlier, Simon, we left our offices March 13th, 2020, with a pending first quarter close beginning on April 1st. If you would have asked me on March 12th, hey, you're going to close your books this quarter and your whole team's going to be remote, I would have said, I'm not signing up for that, right? None of us would have. But we got it done, right? And I think there's something that I took away from the pandemic, I took away from Kenvue, that moving with speed and agility, you may not get it exactly right, but you're going to be much better off than trying to wring your hands and figuring out what is exactly right. Because many times you don't know anyway, especially for things you haven't ventured into.
So just a couple more questions from me, and then we will go to the audience so people can get ready with their questions. We talked a little bit about data science at J&J as a whole. What about within the finance function going forward? What use cases are you interested in exploring and understanding?
Yeah. So right now, I think as we look to what's the right word? Optimize our legacy landscape, which I imagine for many of you in this room is pretty clunky, same at Johnson & Johnson, but we're making great progress around data integrity, cleaning up the data. We're in 170 countries worldwide. You can imagine the different type of accounting that goes on. My CIO, after he started about a year after I started this role, he says, how do you sleep at night? And I said, well, what are you talking about, Jim? I go, everybody's got a tough job and we're all stressed. He says, no, how do you sleep at night? It's really tough to close the books, and I'm worried for you. That was a good wake-up call for me, like, oh, we better get moving on this, right? Because I didn't want to be that CFO. So I think it's certainly helping with compliance. It's certainly helping with data integrity. It should free up time for people in the finance function to be better influencers of decisions. At Johnson & Johnson, in the finance function specifically, we have a little mantra in that we're business leaders with a finance expertise. It's only words, but it's important words because we want to make sure we understand the business. The finance expertise is secondary to helping the business solve problems, right? And so in order to do that, you have to spend more time understanding how that biology is going to work, how it's going to play in the commercial space, how do payers look at a particular solution in healthcare. And so that's very important to free up that time. Where I'd like to see AI evolve for us is getting much more into the predictive side of things. I think most CFOs in the room could say, we're pretty good at looking in the rear view mirror. How do we start looking more at the windshield to not only, I'd say, be more informed about the decisions, but influence those decisions so that there's better outcomes?
So speaking of outcomes, let's go from the specific and focused part of your role to the broad. Let's understand what's happening in the world, geopolitical, China, trade, politics. What framework do you have to understand that, and how do you keep yourself informed and update yourself and your colleagues, particularly through that CFO lens?
Yeah, I think it's really staying in touch with all the colleagues at these different locations. Last week we were in Asia Pacific. It is important to get out to the regions. I know we have gravitated to a little bit more of a bias towards remote interaction. There's something that is lost when it's not eye to eye, face to face. So we found that out. If I think about the pandemic itself, our colleagues in China were on the forefront of informing us as to how we should be approaching work protocols, what to look for, how to keep people safe and healthy. So I think there's a lot to say about that. It's being in tune. So being at a corporate headquarters, you've got to be very cognizant of not becoming complacent. That, well, yeah, we know what's going on because we sit in the ivory tower, so to speak. Getting out, understanding what's going on in the businesses, what their concerns are. How can you, at this level, it's really about eliminating barriers and hurdles. You spoke about empowerment of the worker. That's why America has succeeded. That's why individual companies succeed. A lot of those great ideas are coming from different parts of the organization, usually not the higher ends of the organization.
So last question from me, and then we're going to go to the audience. What do you think, going to pick one, only one,
Sure.
key challenge facing healthcare CFOs in our post-pandemic, geopolitically uncertain world over the next decade? What's your top number one thing?
So I think it is the potential for overregulation, right? I think it's a very much, what's the right word? A political tagline, the way healthcare is thrown around. And we have to do a better job as healthcare CFOs articulating the benefits of some of the solutions that we bring. As people live longer, there's a lot of costs that go along with that. We're talking about not just treating multiple myeloma, we're talking about curing it, right? We're talking about Alzheimer's now with the potential there. I do believe in the next 10 years, most cancers will be curable, right? So people are not just gonna live longer, they're gonna live a high quality life longer. If we could do the same with Alzheimer's, I think that would be great.
Well, so I'm obviously very much about AI right now. That's the current book. But I'm thinking also about the next book, and I'm thinking about drivers of global events. And I do think extension of life, longer, healthier lives, and also the inequality or reducing the inequality of life expectancy in various places, including the United States. I think those are going to be really central social topics and business topics.
Well, you can't have a healthy economy if you don't have a healthy society, right? And so you think about what AI and technology is enabling us to do around access, because that's really what we're talking about. In remote parts of Africa, we now have surgeons, probably from Mass General or some of the best institutions in the world, guiding those surgeries, right? So we're creating access through very virtual means, which is going to lead to better health outcomes.
Great, absolutely. Very inspirational. All right, so let's take a few questions from the audience. Yes, please.
Hi, Yolanda. I'm Simon Johnson's student. I'm working in the supply chain optimization company. Okay, thanks for sharing, Mr. Wolk, about your insight about the technology on the financial and especially in Johnson & Johnson. You mentioned about your Johnson & Johnson is leveraging AI on predictive inference decision. Given the increasing influence of AI, in operation or finance or function technical, how do you envision Johnson & Johnson leveraging this technology to enhance the financial or operation efficiency and driving the growth in the coming years, in the future?
Yeah, thank you for the question. I would say, I touched upon it a little bit before, in terms of supply chain, because of the criticality of the products that we're providing, usually it leads to not only better living, sometimes it's life-saving. We've got to make sure we've got healthy supply chains. So having some of those predictive analytics or that real-time knowledge as to where a potential disruption in the supply chain may happen, looking forward, not finding out about it, I think is critically important. So that's how we're going to plan to do, that's how we are using it. Again, I also think there's a chance that we could have lower cost with respect to drug development, right? If you think about what these algorithms can do in a very short period of time relative to where we were just 4 or 5 years ago, you're going to match up and recruit for clinical trials with patients who are likely to respond to that type of treatment. That is very efficient. We haven't seen it yet, nobody in the industry has, but I think that's the potential. Because drugs are funny things. We're all very unique individuals, and that's why we need personalized medicine. Genetic codes, genetic mutations are all very personal, right? And so there will be solutions where we can look for specific markers, biomarkers, that we would recruit in clinical trials, therefore get much quicker and better outcomes.
And that's the key constraint, isn't it, from the speed, is the human trials. You don't want to, nobody wants to cut any corners there. So that's a key constraint you'll be addressing.
No, you want to make sure that it's safe, right? And then you want to make sure it's efficacious. It's hard to say it's going to be efficacious for everyone. There's very few drugs that are like that because we are just so unique.
Very good. Next question.
Relations Advisor. Can you hear me now?
Say it again, yeah.
Perfect. Beth Kurth, Investor Relations Advisor. Question about the divestiture. When you think about the decisions that you made about people, about technology, about systems, were there any decisions that were harder or easier than you thought there would be? And sort of as part of that, were there pieces that were automated or you ran reports or that used AI in some way? And then how did the human interaction or the human overlay work with those decisions?
Yeah, thanks for the question, Beth. I would say, again, did we get everything right? No, right? But the things that we knew or were not getting right, we course corrected real quickly. And there wasn't anything that was, I would say, disrupted the entire separation. It was more, quite honestly, when we thought about it, it was such a part of Johnson & Johnson's legacy. Probably when you looked at the program and saw CFO from Johnson & Johnson, you immediately thought of Band-Aids, baby shampoo, Listerine, right? Tylenol, Aveeno, great brands, not the med tech or pharmaceutical side, right? And so it was tough. I spoke earlier about my dad, 25 years. He was with a consumer company within Johnson & Johnson. So there was that emotional element that folks had to get over, I think. Surprisingly enough, the Kenvue team saw the opportunity. I would say within a month, they said, boy, bring it on, we're ready to go. Right? I think it was more the Johnson & Johnson side, well, how is this a different company now? But we're much more laser focused on having transformational impact in healthcare. We have, for better than 15 years now, have adopted an approach where if it's a Me Too product, third to market in that particular class, we tend not to go there, right? If there's already a solution that's out there serving the community, let's put our resources, our scientific expertise to something that's going to make a difference. And that's how we've approached it.
Got it, great. Who has the microphone? Joe's in charge of the microphone.
This is Deepa Gajaria. I'm from Biogen. So what's your investment prioritization mantra? Like, just being in biotech, pharma, I think that is the number one dilemma we have in finance. And how do you feel like AI can help? Doesn't help yet, I feel, but in future, we within executives and leadership team want to get there. So thank you.
Yeah. No, I think you're right in that we haven't seen the financial benefits yet to drug discovery. I think it certainly holds great promise, but we still need to see some of the payoff. And it is a worthwhile investment. But in terms of investment prioritization, I'm fortunate in that it's very clear amongst our business leaders, we will prioritize an R&D dollar over a commercial dollar all the time. And our commercial leaders believe that. And I think they believe that, quite frankly, because the best marketing tool is a really good product and a healthy label, right? I would say it's a very, what you might suspect, expected net present value analysis. And what I love about our scientific experts is they're agnostic to where that value is derived. So they may be working on a specific disease area state with a compound for 3 or 4 years, but they get intel that something better is out on the marketplace. They will urge us to go out and get that asset because it's, either it's going to come to market earlier or it's got better efficacy, less side effects. They are agnostic and they don't have that invented here syndrome. I think that's very, very powerful in terms of making the right decision. And it makes, quite frankly, the CFO's job pretty easy because they stack it up in a very quantitative way. Here's the expected net present value. We invest probably $14 billion a year in R&D. It's one of the top 10 investors in innovation in any industry on an annual basis. We take great pride in that. But it's not, if we gave it to the immunology franchise, we now have to give it to the oncology franchise. Or we did something in med tech, so now we've got to do something in pharmaceuticals. We just look for the next best opportunity. I think many of you are probably faced with the same dilemma that I have. It's not a matter of having good choices available to you. It's how do you pick the great ones within that selection of good that's going to make the difference.
Okay, next question. Who has it? Joe? You need to keep, you don't wave at me, wave at Joe Falco, who has the microphone. He's the person that empower you here.
There are still in the market some medications that are not available readily. For example, and I'm not sure whether it's your brand or not, but Tylenol for babies. My son-in-law had to go to 7 pharmacies to get some Tylenol and some other medication. Everybody is saying, to me at least, that it's result of the pandemic. So what lessons did Johnson & Johnson learn from the pandemic, and would you carry more inventory in case there's a next pandemic coming, and how to deal with it?
Yeah, no, it's a great question. It was pandemic related, but not from the perspective of supply constraint. It was because there was a run on the product. People couldn't get enough Tylenol. We quickly ramped up. We converted some lines from other products to go 24/7. But that takes a little bit of time. You need FDA kind of approval to change your processes. So that took a little bit of time, but it was more the demand situation. The pandemic did give us reason to pause and say, are we overly dependent on 1 or 2 locations for any of our products? And again, we kind of take a lot of pride and care with that because it could mean somebody's life or a healthier living at least. And so that was a good moment, I think, to just stop. The good news is we were pretty well dispersed. We made a couple adjustments, but we weren't heavily dependent on any one geographic location. We had dual source, which as a CFO, you can imagine like, well, is that the most cost effective? So there's always that balance to make sure that you don't want to have inventory that you're going to have to write off to slob in a year and a half's time, but you also don't want to be out of product when the products are so important.
Okay, time for 1 or 2 more questions. Who has the microphone?
Nina Trentman from Bloomberg. You mentioned baby powder earlier, which of course is one of the things that the company is still working through in terms of litigation. Just wondering, as a CFO, how involved are you in this process, given that it involves courts, it involves sort of your legal team, I assume, and also how do you think about the legacy of that going forward from a financial perspective?
Yeah, thank you for the question. Yeah, it is certainly one of the issues that is associated with our company. As part of the separation, we did maintain the liability in North America for any baby powder talc allegations. I would tell you that we stand by the science, which is decades old. It's done independently about the safety of the product and the lack of any asbestos in that product. It's an unfortunate aberration, I think, with respect to what is otherwise a very good legal system here in the U.S. Plaintiffs' attorneys can use junk science, put ads on TV that are now funded by private equity, and drum up a lot of noise in hopes of getting some type of settlement. We will continue to defend the cases. We've looked at other means in terms of bankruptcy filing. We're also going to try to shed some light on just exactly what is happening with respect to this, like I said, an aberration of the judicial system in the U.S. I think that's important because that could happen to a lot of companies. It's not just Johnson & Johnson. If you think about any consumer product that's out there, you don't need evidence that you actually use the product. In medtech and pharmaceuticals, you do have that evidence. You have a prescription, you have a procedure record. With consumer products, you just have to allege. And there was one court recently in Alameda County where our team was able to prove that a photo was altered. It was photoshopped, quite frankly, to show when little Johnny supposedly was using baby talc powder with, I'll just leave it there. It was altered. The judge did not allow that to be presented as evidence to counter. So there's, unfortunately, there's some bad actors in the system. It's not, by and large, it's not the majority. I do want to assure you, though, at Johnson & Johnson, our legal team is working on that. So 99.9% of the people at Johnson & Johnson are working on better healthcare solutions and how we bring those to people across the globe. It is really a small legal team that is focused on this. It's not distracting from what our core purpose has been for the last 137 years, and hopefully will be for the next 137.
All right, so last minute or 30 seconds, I think we're done with questions. What are your final thoughts or words of encouragement to our audience today?
Yeah, so it's a very exciting time. I would say embrace the role that you have. One thing I didn't get to in the opening soundbite was the role of CFO as communicator, right? I think when you think about a CEO, a CEO has to be much more of a cheerleader many times, whether you're speaking internally or externally. CFO can still be very optimistic, but bring a little bit of balance to that. And I do see an evolution. I had the good fortune, I think by happenstance, my wife actually thought they threw me out of finance when they put me in IR. She goes, like, he's not getting a CFO job. I found that out after I got this job when we were out to dinner with some friends. But having that experience was actually pretty profound as to where the CFO function has gone recently. There's a lot of things that are happening, and they happen real fast. Finance people are really good at explaining those in plain spoken language. And I think living into that skill, whether it's internally with your employee base or externally with investors or people who have an interest in your company, I think that is one of the untapped things that is changing more rapidly with each passing year.
Great. Well, thank you on that note. Joe, thank you very much for your time.
Thank you, Simon.